All hands on deck. That's how neurosurgeon Roger Hunter sums up the urgency with which he's responded to the pandemic. His thing in a nutshell: early home-based treatment for COVID sufferers. Not as a substitute for vaccination, but in light of overcrowded hospitals and gloomy stats, something of a ray of hope for folks infected with the virus. He himself got COVID whilst treating a 104-year-old lady and her daughter, a medical doctor, both of whom later recovered. And he's become something of an outspoken advocate of getting help to those that need it where they live.
What do you know about the positivity rate right now?
Let's round it up to 50% as a generous, as a conservative estimate.
And what are the implications of 50% for the hospitals?
It means it simply can't cope.
Government's message right now is clear: get vaccinated. They finally have vaccines in Jamaica.
Vaccines are a part of the solution. They're not the magic bullet. We endorse and support vaccine. But what is missing? The obvious elephant in the room: therapeutics, early therapeutics. One, they must have regimented oral hygiene. Floss your teeth, brush your teeth, Listerine or some other mouthwash. At least that process should take you at least 2 minutes to do it properly. You do that after every single meal. So if you eat 5 times a day, you do it 5 times a day. And certainly before you go to bed in the night. You want to steam with menthol, steam with eucalyptus, steam anything that's inhalational. We also want people to know rest, good old rest. It works. You cannot be running up and down, cutting the lawn whilst you have coronavirus to recover from. You must rest, but you need to have your pulse oximeter, the key tool, along with your temperature monitor. But the pulse oximeter, I want Jamaica to see. Every Jamaican must be competent, must be COVID champions and COVID competence. A pulse oximeter, easy to read than a blood pressure machine. Saturation 90 to 100%. 90 to 100% in a good zone. When you go down 90 to 85%, you need to start breathing steam more often. You need to be on antibiotics. You probably also need to be on some dexamethasone steroids. Underlying all of this, every Jamaican needs to have a friendly doctor, a friendly doctor's number.
Are you currently treating COVID patients?
I've treated close to 200 now.
How many of those 200 patients have died?
Not one, not a single one. I got it about April this year when my colleague with her mom went into the hospital, contracted coronavirus and came home with it. And so she passed it on to her daughter. This is a very common story. Her mom fractured her hip at 104, went in for a broken hip for it to be repaired. She developed coronavirus. It was thought that, well, this is it. But I said, no, we're not losing her. Immediately we started her on antibiotics, levofloxacin. We started on blood thinners, Xarelto. We started her also on dexamethasone, a steroid, which is known to every neurosurgeon in the world. This is easy. Dexamethasone is nothing new. Very simple, cheap drug. And guess what? We started early intervention, gave them some fluids as well, and immediately improved them. Their strength improved.
You're saying if you don't respond early, then the mortality rates go up.
When you miss the ball, terrible things happen. You cannot ignore that sniffle, that cough, that headache, that runny nose, that tiredness, that loss of smell, that loss of taste. You can't ignore it. We need to have treatment from the beginning. Absolutely, the mortalities go up if you get treated late.
And bring it home to people once more, because they need to get the message. What is it like to have it in its final stages?
It is absolutely horrible. Gentle people, observe the protocols. Wear your mask, social distance, sanitize, oral hygiene, steam. If you're offered the vaccine, avail yourself of it. Make sure you don't have coronavirus. It is essentially drowning, air, hunger. In the final stages, even lung cancer is more merciful than coronavirus. It is so sad to use that example. Let's get vaccination. Let's get early treatment at home. Early treatment at home, and let's get a doctor's number into every single household in Jamaica. Everybody must have a doctor's number. This is not the time to be going off and having a jolly and having a party in July. It is not the time.
And if you were telling Andrew Honest to change course in one important regard, what regard would that be?
Early treatment at home. Simple. Early treatment at home. Give people knowledge, medical knowledge as to what they can do to enhance their survival. When their nose starts to run, when they start to have a dry cough, let us get the oxygen saturation in every home. Take every fee, every custom fee of these things. Take every custom fee of the contactless thermometer. Let's get the medication down and let us apply help to the cost. Let us apply government taxpayer money to the cost of these drugs so that monoclonal antibodies are not $250,000. They are $20,000. It can be done. It is time that we get our business in order, get our house in order, work together, and recognize that Jamaica has 5 times less the mortality as it compared to England with better resources. England has deaths of 250 per 100,000. Jamaica has deaths of about 50 per 100,000. Haiti, 5 deaths per 100,000. Haiti is unvaccinated, and God knows Haiti can't take anymore. In Haiti, more people died in a few minutes Saturday before last than the entire people who died from coronavirus in Jamaica. Are we ready? If the earthquake hit Jamaica, what state would it find our health sector? Would it find a state where all the beds are full, with people who could be treated at home? We need to have a rethink, an urgent rethink.
And if you didn't know, Dr. Roger Hunter is running for the Medical Association of Jamaica's top job. He says by way of a pitch for votes that he doesn't have a government contract. Make of that what you will.